Anemia describes the condition in which the number of red blood cells in the blood is low. Red blood cells are transporters of oxygen to our organs that exist in our blood. In a healthy male body, there are around 4.7 to 6.1 million red blood cells per microliter. And in a healthy female body, there are around 4.2 to 5.4 million red blood cells per microliter. However, if you have anemia, then you have a lower amount of red blood cells in your blood. This signal shows that there is a disease in process. Therefore, anemia is a sign of a disease rather than a disease itself. So how does this happen? And why does it happen? How can there be a lower red blood cell count in your blood? There are numerous causes for anemia, but the major one is due to lack of nutrition. For the red blood cells to function properly, we need iron, vitamins B12, and folic acid. A shortage of iron is the most common cause of anemia in many countries, known as iron deficiency anemia. We will also look at 3 other causes of anemia. First is blood loss. Red blood cells can be lost through bleeding, which can occur slowly over a long period of time and can often go undetected. It occurs commonly in gastrointestinal conditions, in menstruation, and also in childbirth, especially if menstrual bleeding is excessive and if there are multiple pregnancies. Anemia can also be caused when the body produces too few red blood cells. This can be caused by sickle cell anemia, which is an inherited disorder. This causes the red blood cells to break down rapidly, so oxygen does not get to the body's organs. Or it can be also due to lack of vitamins. Or even bone marrow and stem cell problems. Or the most common, iron deficiency. The last cause of anemia we will talk about is destruction of red blood cells. When there are stressors such as infections, drugs, or toxins, red blood cells can be destroyed. So who is most likely to be affected by anemia? Smokers, pregnant women, people who do excessive diets, older adults, people with alcoholism, and even children. In the United States, 2 to 10% of the people have anemia. Other countries have even higher rates. Young women are twice as likely to have anemia than young men because of regular menstrual bleeding. Up to 10% or more of adult women under 49 years are iron deficient. Hispanic American and African American women have double the prevalence for anemia compared to Caucasian women. Up to 20% of American children and 80% of children in developing countries can become affected by anemia at some point during their childhood and adolescence. Again, iron deficiency is the most common cause, but other forms of anemia, such as hereditary blood disorders, can also cause anemia in this population. Hispanic American children have double the rates of iron deficiency as African American and Caucasian children. Young children aged 9 to 18 months have the highest risk for iron deficiency anemia in the US. Infant boys may have 10 times more risk than baby girls. What is the quality of life for people who are affected by anemia? They are affected by headaches, dizziness, or ringing in the ears. They become very weak and fatigued, and also their heartbeat can race, and they become very, very pale in their faces. It can be predicted that the lifespan of people who are affected by anemia are ranged from 20 to 30 years. Then are there any treatments for anemia? Fortunately, there are. One can get iron supplements, or transfusion of red blood cells/blood, or one can get erythropoiesis-stimulating drugs. Erythropoietin is a hormone that acts in the bone marrow to increase the production of red blood cells. This I will explain in depth a little later. Patients need to be cautious when treated with iron supplements because they can cause gastrointestinal problems. There are also other common side effects such as 1. Constipation and diarrhea, 2. Nausea and vomiting. An excess iron can also cause heart disease, diabetes, and certain cancers. Now going back to one of the treatments, let's look at erythropoiesis-stimulating drugs in depth. This drug is only approved for certain anemia, which is anemia caused by chemotherapy, not anemia due to other causes in patients with cancer. This drug can also be an important treatment for patients with chronic kidney failure and also for patients who have anemia caused by zidovudine therapy. Erythropoiesis-stimulating drugs can help increase the number of red blood cells. However, it does not help improve anemia symptoms. There are also, unfortunately, side effects to this drug, such as blood clots and swelling, and also it does not prolong the survival of a patient.